We've been talking about sleep apnea with Dr. Chandra. Dr. Chandra, this next question is very interesting. This is a 52-year-old who had his annual physical, and he says, should I have been tested for or talked about sleep apnea? So evidently in his annual physical, this wasn't mentioned. They were wondering, since this is such a big problem, 20-some million Americans, should have that been included?
Well, so far it's not been included, but that's one of the things that I've been trying to, and that's the reason I'm here today. Several years back, I started this Primary Care Sleep Society. The main purpose of that was that we need to screen for sleep disorders as a part of your annual physical, just the way we check for cholesterol, diabetes, for do a PSA for prostate cancer, because it's a simple questionnaire which can be just administered by the nurse as the patient's waiting. So, and what he's brought home is just an excellent point. I feel strongly that this should be a part of an annual physical for every single person.
And I agree. And just think about the money saved if you can detect sleep apnea early and prevent an accident, improve quality of work, heart attacks, atrial fibrillation, headaches, high blood pressure, and all the costs that go with that. That would be big.
Absolutely. Motor vehicle accidents.
Now we can work on the awareness thing, but what would it take to really enact this? And how long would it take to fill out that questionnaire?
Oh, it takes less than 5 minutes, Jim, to fill it out. And it's, inexpensive. It can be downloaded from, the internet. Any of the sleep centers has it. And all people have to do is just, type in sleep questionnaire or Epworth Sleepiness Score or ESS, and they have access to it.
That is great.
Yeah.
Here's some more questions that we have about information. And this person wants to know, where can I go to learn more about sleep apnea? So, if a person, let's say they wanted to learn more in sleep apnea, where would be the first place you'd send them if they couldn't go talk to a doctor or a sleep specialist?
Sure. And there are several places. What I would first direct them to is our website for my center. It's www.sleepforhealth.org.
Okay.
And it's easy to remember, sleepforhealth.org. Once you go there, you can click on links, and it'll take you to several different sites. The one that I recommend is the National Sleep Foundation, or NSF.
Okay.
And it's got a whole wealth of information about the links between sleep disorders, sleep apnea, stroke, high blood pressure, atrial fibrillation. So you just have to punch in the keywords and you'll get all this information.
Sometimes we as people have to take our health in control. And I hope that now, if they didn't have a computer, what would you do? Some people might not have a computer or web access. Would you call a phone number or?
Yes, and there is several, different places that you can get information. You can start off at the local library.
Good.
And, just go to the section either on science or on sleep. There is a lot of books which are available. And most of these places, whether it's the National Sleep Foundation, the American Academy of Sleep Medicine, they have 1-800 numbers. And you can just call them, and they'll be more than happy to send you, informational stuff. Our office, and I'll be more than happy to give that number, would be happy to mail those.
Great.
So that's not a problem at all.
And they can be free to go to our website, and we'll link for yours. And our website is heartwiseministries.org. I got really a quick question. We got about 30 seconds to answer this one. It says, is it true if I lose weight, sleep apnea can be cured?
Yes, that is exactly right. For a lot of people, it is directly related to the weight. But the problem is that unless we treat sleep apnea, the body's metabolism slows down. We know there's two hormones that have been found in the past 10 years or so, leptin and ghrelin. Leptin is the satiety hormone, which gives us this feeling of being full, of not wanting to eat anymore. And both of these, their levels get disrupted with sleep apnea. So once sleep apnea is treated, then you're able to lose weight, more. You have more energy to go out and exercise. So, but yes, if you have enough weight loss that you can attain, you can treat sleep apnea with that for a lot of people.
And so you would test, let's say they wore the mask for a year or two, they lost 40, 50 pounds. It's reasonable to test them again without anything to see if they needed treatment?
Absolutely, and that's the way to go, Jim, and you really hit the nail on the head, because people say, well, I lost all this weight, I just stopped using the CPAP. Well, we don't know. We've got to have objective evidence because we are dealing with a potentially life-threatening condition, Jim. So you're exactly right. We always want to bring them back and test them to see that they don't have it any longer.
Well, that is fantastic. This is all very interesting. We have a couple more questions that we're going to talk about sleep, how to get better sleep after the break. If you might have a question for HeartWise Ministries or Dr. Chandra, go to our website. That's heartwiseministries.org. When we come back from break, we're going to talk about ways you can sleep better. I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy. Welcome back to Heart of Health. We're talking about sleep apnea with Dr. Chandra. And this last segment, we got some very interesting questions to discuss. And you know, God made us all to have these rules that govern our bodies. And one of these rules is rest. And God made us to rest at night. He made us to rest, to take weekly rest. And this sort of renews our bodies. And everyone out there wants to know how they can rest better, because in this well-marketed world, we're going all the time, we're eating big meals at night, we're caffeinating ourselves every day. We're just not getting that rest. And I think we've convinced people that it's causing major problems, and we're not really solving the problem at all. So let's give some suggestions here about how people can rest better at night.
Right. Jim, you summed up a lot of things which people are doing to themselves to really damage their sleep, which is the healing part, of your daily routine. Mm-hmm. So have a relaxing bedtime routine. That's really important. If you think you're going to watch TV, work on your computer, and then suddenly be able to go to sleep, it's not going to happen. So also avoid alcohol, avoid caffeine in the daytime, and avoid taking long naps in the daytime, because then your sleep cycle is going to be disrupted and you will not be able to go to sleep at the right time. Avoid bright light. So basically have a worry time, sometime in the evening where you can write down all your problems that are bothering you, and so that when you wake up in the night, they don't take up a life of their own. And you say, well, I've written down all these things, I'm going to deal with them, tomorrow morning, I'm going to have faith in God, and He's watching over, leave all my problems to God. And that itself solves a whole bunch of things. Mm-hmm. So basically implementing all these little things can make a huge difference.
Yeah. Now, how do you feel about medications to put people to sleep?
There is a lot of research, Jim, which shows that there is therapies like, cognitive behavioral therapy, which is relaxation training and involves several other things, which work as well as the medications. Mm-hmm. So unless we first tried all these other things, medicines are an easy crutch. Mm-hmm. And in certain cases, yes, they have a definite role. There are people in chronic pain, they have multiple other medical problems, which is, impairing sleep, and they do have a role. But I personally feel that they're, really overused. We go to them really quickly, and then there are side effects, that are there with all medications.
And sometimes they don't get at the core of the problem.
Exactly. And just what you were saying, because then we are treating the symptoms. Because if you're not able to sleep or you're waking up more frequently, is there a medical problem, or do you have sleep apnea? Do you have restless leg syndrome? Mm-hmm. Is there something else which is causing the interruption? So rather than just, covering it up by giving a medicine, we need to be treating the problem.
That's absolutely right. Well, this has been a fascinating discussion, and unfortunately, we're out of time. I've learned a lot, and I hope our viewers have learned similarly how important this is to get good rest. We'd like to thank you for joining us today on Heart of Health. Visit our website at heartwiseministries.org.